Hi everyone, welcome back to Talking About Mental Health. Janae here, and now I'm going to share with you what to expect during counseling or therapy when you're struggling with depression. If you haven't seen my other depression videos, for example, like how I cope with depression, or what is depression, helping a family or friend, a family member or a friend, and I think I'm going to post 20 signs of depression. But if you haven't seen those, please check them out if you're looking for more ways to cope or more information. But in this video, I'm going to be talking about what to expect. I personally go to therapy for depression and anxiety. And I've been going for probably about a year now. I started in May, at the end of May, when I was 15, I believe, and I'm 16 now. So here's what to expect. Sessions may last about an hour, about once a week, although this depends on what is best for you and the person that you see, okay? If after 2 or 3 sessions you do not feel comfortable or you don't feel you have a good working relationship with your therapist, it may be best to see someone else. And if you tell your therapist that, they won't get mad at you. They won't, if you're afraid of making them feel bad, they won't feel bad. They're used to it. And they want to help you the best way that you can. For example, if you have an eating disorder and you go to a therapist who maybe doesn't specialize in that or doesn't have many patients who have that, that's not their main focus, they might not be able to help you as well as another therapist maybe who actually really works with a lot of patients who have eating disorders. So she may refer you to see someone else just because we want the best care for you. We want, they want, should I say, what we can really do for you. And if we can't offer that, that to you, then we're going to refer you out. Okay, so next. So with a therapist, you should always develop goals and have kind of like where you want to be in maybe the next few sessions or the next 7 sessions, however long you're going to be there. And you should always feel comfortable with your therapist and be able to talk honestly, because they're there to help you. And by lying to them, you're just wasting your time, and you're just wasting their time, and you're not going to gain anything out of it. What to expect. Your first meeting. Okay, your first meeting. I remember going to my first meeting. I was so nervous. They're normally going to ask you what brings you to therapy, your concerns, any symptoms that you're experiencing, and maybe ask you a lot of questions. May want to learn about your childhood, your education, history, work history, current relationships, and long-term goals. So they want to get to know you. They're going to want to build rapport with you, just to know what you're like and what you like to do. Opening up can be hard, and it may take time for you to actually trust your therapist. It is okay to say that you do not feel ready to talk about something difficult right now, and your therapist should not force you or try to make you say anything that you don't want to talk about. So maybe, let's say you have PTSD and they want you to talk about something traumatic that happened to you. They shouldn't force you to talk about that. If you tell them, I'm not ready to share that right now, they should be okay, fine by me. And if they want you to talk about something that you're not ready to talk about, then maybe it's best to see a different therapist. So, let's see. Your thoughts and feelings will help your therapist understand you and how to help. It is important that you feel comfortable enough to say what is on your mind. Okay. Following meetings. Sometimes therapists have different approaches. They see all different kinds of people and people from different backgrounds, cultures, different mental health problems. So some therapists might do CBT, cognitive behavioral therapy. Some may do DBT, dialectical behavior therapy. Some may do EMDR. There's many different kinds, which maybe I'll explain in a later video. So it's always important to tell them kind of where you want to go with therapy and how you want to improve. A good therapist will guide and support you and challenge you when you are ready to be challenged. It is normal to disagree with your therapist from time to time. When this happens, it is important to honestly share your feelings or concerns. This will help you and your therapist to agree on how to handle this. The goals of therapy. Keep in mind that therapy is designed to equip you with a long-term solutions rather than a quick fix. So you're not going to notice really much changes overnight. You may feel relieved that you're finally getting help if you have been waiting for a long time, but for your problems to actually start to get better, it might take a while, and that's okay. Any change in your life involves time and effort. Your commitment to attend meetings regularly, courage to look at yourself honestly, and willingness to make some difficult changes in your life will help you make progress. So if you're making a goal or you want to make progress, you're going to have to change something. If you don't like what you're doing now, or the people that you're around, and you want to get better, you're going to have to change, and it is going to be hard. You're going to have to change your thinking. You might have to change your behavior, the things that you say to yourself. Self-talk can be really important, and it can really bring you up, and it can really bring you down. If you have a positive self-talk, like, I'm going to pass this quiz, I can do this, I've been studying all night, I believe in myself, and even if I don't do as well as I maybe think that I will, then it's okay, I'm just going to try better next time. That's positive self-talk. But if you have self-talk that is more negative, such as, I'm a loser, I'm never going to do this, I don't even know why I try. I mean, it's just, I'm just wasting my own time, I already know that I'm going to fail, and I'm never going to get anywhere. If you talk like that to yourself, just in your mind or out loud, how do you feel? Do you feel better about yourself, or do you feel worse? Most likely you don't feel better, and you just feel worse. So be a thought detective and watch how you're thinking to yourself and what your self-talk is like. Alright. How long does it take before therapy starts to work? Often people start to feel less depressed within the first few weeks of treatment. Many feel better once they know they are doing something to deal with their problem. How long does therapy continue? It depends on your situation. Most people require 8 to 20 sessions to reach their goals for treatment. Sessions are often weekly to start, then spread out more. And that's pretty much it. Some people prefer to have female therapists, some people prefer to have a male therapist. So they're supposed to be there to help guide you and do all that they can for you. So keep working with them, and I hope this video helps or gave you some new information. If you're interested in doing counseling or therapy, I'm really proud if it was hard for you and you actually was like, okay, yeah, I'm gonna do it. It takes a tremendous amount of courage, and just know that I am very, very proud of you. I hope this video helped, and I will catch you guys later. Bye! If you want more information on this, I don't know why I said bye, I'm not done. If you want more information on this, check out thequestion2expression.com. Bye everyone!